Dr. Mark Solomon. I'm a plastic surgeon and happy to be a partner with Kygo Health. I grew up in the Philadelphia area and have lived here most of my life. It's a great place to live. I went to medical school at New York University, did my residency training at the University of Pennsylvania, Thomas Jefferson University, and in Paris at Hôpital Necker. And in doing all of that, I've learned a lot about life. I loved living in France and learning about the French way of life, the French culture, French food, and French medicine, which actually is quite good. In addition, I am proud of the fact that I've been a lifelong Philadelphian and take care of people from here and New York. And it was a wonderful opportunity that I had a few years ago to open an office in Manhattan, so now I get to go back and forth between both sites, continuing to see patients not just from New York and Philadelphia, but from all over the United States and in fact from all over the world. I've been a plastic surgeon for 30 years. It's hard for me to believe that, frankly. And what stimulated my interest was actually a lecture in medical school regarding what was then a very new field of surgery called craniofacial surgery. Craniofacial surgery then was treatment of severe birth defects of the face by literally moving the brain out of the way and working on the facial skeleton from above. That was pioneered in France, which is why I went to Paris to do my fellowship. I have practiced that. I use those skills every day in not just my reconstructive practice, but in my cosmetic practice, because those techniques, the thinking behind those principles allows you to really evaluate people's appearance from head to toe, quite frankly, and determine what the optimal treatment plan is for their care. I also have a terrific opportunity to use my pediatric skills at the Shriners Hospital for Children, where I spend about 20% of my time helping children with significant birth defects and traumatic and burn deformities from all over the world. Patients are anywhere from about 21 to 75 because I do facial surgery, body surgery, nasal surgery, eyelid surgery, breast surgery, tummy tucks, liposuction, the full array of cosmetic surgical procedures, as well as laser treatments and skincare that we have here in the office to help people really maximize their appearance, to optimize their appearance. Well, first of all, I'm very hands-on. It's a very one-to-one relationship that I try to develop with my patients. I make it a point to be available 24/7. I'm a little old-fashioned in that we use the phone more than the internet, but in fact I have patients from all over the world who quite frankly do send me email and photographs, and we will use Skype and a variety of other mechanisms to stay in touch. So I think it's important to be in contact with my patients as often as possible and as often as they need me. So that personal relationship is the essence of how I practice medicine. And I firmly believe that when patients ask me to participate in their care, that it's my privilege, and I want to respect their autonomy and their decision, but also support them through the process, because I know that having surgery is a very big decision for people to make, and they're going to go through changes that they haven't even thought about as the process unfolds. But the beauty of this relationship is that I'm very comfortable with all those changes, and I can anticipate what's going to happen, and I can reassure them along the way that we'll get them through. When I'm asked this question, I always think of a woman by the name of Janet, who came to see me quite some time ago for a consultation, and she was very upset. Her marriage of 20 years had fallen apart, her husband had left, she had 3 children, and she had lost her whole self-esteem, her life was shattered. So she was virtually in tears. We worked out a plan to address all of her concerns, because her concerns were, first of all, she didn't look like she looked like when she started out in her young married life. She didn't feel like she felt like in her young married life. Her 3 pregnancies had taken their toll. Years at the beach and outside with the kids had affected her skin so that her face was sun damaged and photo aged, making her look older than her years. So we worked out a plan, and the plan was multifactorial. We worked on her body. She had a tummy tuck, known as an abdominoplasty, breast implants with a small implant and a lift to help restore her shape, narrow her waist, flatten her tummy. This gave her the confidence to go back to the gym and maintain her weight and keep her physically fit. In addition, because her face had seen the sun more than it needed to or should have, we started on a program of skin care, peels in the office, some laser treatments. At 1 year, she looked phenomenal, and she was going back into life, and she got herself a job, and she was moving along, and her self-confidence had been restored. What was really great was several years later, I got an invitation to her wedding, and she put a note in there that said, "I'm so grateful to you, thank you, Dr. Solomon." And that has stuck with me as an important lesson, which is that patients come to me often in a weak and vulnerable state, and I try very hard to support them, not just physically, but emotionally through this whole transition to get them back to where they need to be to enjoy their life. The whole purpose of aesthetic plastic surgery is to help people maximize their opportunities in life, both physically and emotionally.